Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspective and insights within the field of otolaryngology. I'm your host, Rahul Shah. Let's jump into it. Welcome to Voices of Otolaryngology. I am super excited to be here with Dr. Kaffenberger and Dr. Seuss. We're going to answer the question that I know many trainees have. You ready, guys? Do I need a sleep fellowship? But before we do that, let's introduce our colleagues. Dr. Kaffenberger, would you like to start first?
I'm happy to. So my name is Tom Kaffenberger. I am a assistant professor at the University of Pittsburgh Medical Center. I also spent some time at the VA of Pittsburgh as well, but I'm dual boarded in sleep medicine, sleep surgery, as well as otolaryngology, largely due to my other colleague here, Dr. Seuss, who was very influential on my path to this specialty.
So can I call you Thomas? Tom Kaffenberger?
You can call me Tom. Yeah, that's perfect.
Did you do a sleep fellowship?
I did. So I did at Thomas Jefferson.
With your partner, Dr. Seuss, do you want to introduce yourself, and perhaps you've trained Tom?
Yes, happy to. Of course, I trained Tom, so he's in my mold, and I'm an associate professor at the University of Pittsburgh in the Department of Otolaryngology, and I'm also a sleep medicine physician. So I was one of the first ENTs in the country. This was back in 08, 09, to decide to do a sleep medicine fellowship, and then became dual boarded in both sleep and ENT. And I think really what that's allowed me to do is open a comprehensive sleep medicine, sleep surgery practice, which we opened at the University of Pittsburgh about 15 years ago.
That's fantastic. I like to keep these light and energetic. So no disrespect when I show you my Aura ring. I love it. And my sleeping saturation is 96%, and I get a score of 85 with my sleep. Do you know how to interpret that, Dr. Seuss, on the Aura ring?
Well, I guess I would just say I wish all of our patients were as healthy and, on point as you. It'd make our jobs a lot easier.
So, Ryan, why don't we start first? Because I finished fellowship in 2006. I think you might have been just a year or two behind me because you went right into sleep fellowship. Can you tell people your path there?
Believe it or not, I was trying to decide between a number of different specialties, from pediatric otolaryngology to facial plastics and others. And I ended up joining the University of Pittsburgh as a general otolaryngologist. This was back in 2007. And then fate would have it, in my first year of practice at the University of Pittsburgh, I decided to attend a sleep surgery cadaver course. And I'm there elbow to elbow with some of the sleep surgery gurus in the entire country, Tucker Woodson and Ed Weaver. And then I had other mentors back home, like Pat Strollo, who was the president of the American Academy of Sleep Medicine, Jonas Johnson, past president of the AAO, and my former chair and mentor. What was interesting was at that time, 07, 08, all these new things were coming out. There was a new sleep medicine board that was being developed, and ENT was now part of it. A new exam. There were new pharyngoplasties being developed, like the expansion pharyngoplasty. This American Academy of Dental Sleep Medicine was founded for oral appliance therapy. There was talk about a new nerve stimulation device that we now know is Inspire therapy. And all that was going on right around 07, 08. And so I got sucked into this, and it was just an amazing culture to be part of at that early stage in its infancy. And so I had to make a tough decision. And at that time, I decided to go all in, quit my job, much to my wife's dismay, after just 1 year in practice, and decided to go back and apply for a sleep medicine fellowship. And I'd say the rest is history.
And then, Tom, what was your inspiration? What was yours? I think for Ryan, it was being cutting edge. And I'm getting chills, Ryan, because I remember that, right? My wife is pulmonary critical care, by the way. Mm-hmm. So we share a joy of sleep on many levels. But so it's fascinating. I remember that time. It was a really exciting time. And kudos to you all standing on those giants and taking it to another level. Tom, when did you train? When did you finish?
So I finished my residency in 2022. And so when I first started residency at University of Pittsburgh as well, there's like another decade of essentially advancements as well. Inspire was approved and was happening, and Ryan was really leading that. And when I was going through my training, I was looking around to see, where was my niche? Where did I feel like I fit in? And what I was really looking for, though, I was looking for something that had good surgery. I was looking for something that had good patients, happy patients that I could actually help. I was looking for something that had good science, and I ultimately also something that had good life. And when I looked at Ryan, I was like looking at his practice, looking at his life. I was like, I felt like had it all. And so I I got really interested and really invested in the sleep side of ENT. And I subsequently followed his footsteps in terms of, applying for a sleep medicine and sleep surgery fellowship. And I've been thrilled and have been very satisfied from all of those aspects moving forward. And, I will say that, having Ryan here is actually, if you look at like coaching trees, like Ryan's coaching tree when it comes to actually like the sleep field these days, it feels like he has populated at least a quarter, maybe half of the more recently sleep medicine ENT dual boarded physicians for it. I mean, he's really had profound impact on the field. And I'm not alone in feeling that way, that, you're coming through his clinic, and as PGY3s at Pitt, we rotate with him, and it is really profound and really influential rotation for many of us.
Wow. So, yeah, Rahul, I don't know how it was when you trained, but I feel like sleep wasn't really a big part of the curriculum in most ENT residencies. So that was one of the first things we tried to do, is develop, just like residents rotate on head and neck and pediatrics and rhinology. Back in 2010, they started rotating through sleep medicine and sleep surgery. And what was one of the most rewarding aspects of this is that you see that when you show people the amazing results that you can get, and how rewarding it is to see patient outcomes in the sleep space, and also all the research doors and academic doors that a sleep fellowship opens, you see that people are engaged and they want to do it. So now, like Tom said, the sleep surgeons at Penn and Vanderbilt and NYU and Cleveland Clinic and all over Colorado, Harvard, all were some of our former residents there at University of Pittsburgh.
So this is how I'm going to judge you, Ryan. You get one answer. Is it a Parcells-Belichick coaching tree? Or what's your coaching tree?
It's definitely not Mike Tomlin's. That's a pretty poor one. So I hope I'm maybe somewhere in between. Yeah.
So really interesting. Can you help our audience? So our audience is our 15,000 members. Really today we're focusing on residents and fellows, young physicians, but I also want to educate our comprehensive otolaryngologists. Now, these days, Ryan and Tom, how much time do residents spend on a sleep rotation? I didn't even know there was a sleep rotation.
Where I trained here at Pittsburgh, we had essentially a dedicated 3-month block with Ryan. That means we're in his clinic, we're in his operating room. It's really like a tight mentorship rotation for us. If you look beyond, I think—
Tom, what year was that when you rotated on that service?
Oh, that would be in 2020.
PGY.
PGY3, I'm sorry.
Thank you.
PGY3. And so the nice thing about having that early on, I think a lot of residents, when they are juniors and kind of transitioning into that senior role, they're looking to say, okay, where's my niche? What do I like within this field? And for us, it was really just kind of shoot in right out of the PGY3. It was perfect timing for us. And if you look, I think across the country, there's starting to be more and more of that as well. But, if you look at the, ENT workplace service, the workplace service survey that the Academy put together for it, sleep is actually quite low on there. And that's something, we're really interested in and trying to change and trying to get the word out about this. And part of the reason why we're here.
And I would, give Tom here credit too. He's even expanded it and taken it to another level, as well as our other sleep surgery colleague at Pitt, Rachel Whalen. So Tom has now expanded the residents' sleep medicine and sleep surgery experience to a suburban hospital as well as to the Veterans Hospital. And then Rachel Whalen, one of our residents, did a sleep fellowship at Penn and also did a pediatric otolaryngology fellowship. So she's one of the few in the whole country that's now dual boarded in pediatric, or I should say triple boarded, pediatric otolaryngology and sleep medicine. And she leads our sleep surgery services at the Children's Hospital. So residents now, really, it's much more than just me. They get exposure on the university end, Children's Hospital end, and Veterans end.
So Ryan, on your faculty, I think I can count to 3. There's 3 of you that are sleep boarded. Is that right?
That's correct. Yeah. So we have 3 sleep boarded ENTs and 3 sleep physician assistants in our team.
Oh, wow. That's also very smart pathway to have the physician assistants. I want to help our residents who are PGY 3s and 4s quickly walk me through the process. So is it a PGY 4 decision they make or PGY? Yeah, Tom, you're closer than us.
So it's a little bit different of a pathway than a lot of our other ENT subspecialty colleagues because, those applications are typically going in like PGY4, and then otology is usually even the last amongst our current subspecialties, but this is actually even a little bit later. And it's
Oh,
important that, when we talk about this, we should differentiate and talk about some of the sleep fellowships out there because there's a lot of variability within it. There are some that are pure sleep surgery, they're non-ACGME accredited. There are some that are hybrid, meaning that you get the sleep surgery aspects of it, but you also get the essentially the sleep medicine component.
yes.
And now you simply then go and take your sleep medicine boards. Back in 2011, they made a change. So the American Board of Internal Medicine basically said, if you want to be a sleep medicine physician, a boarded sleep medicine physician, you have to sit for an ACGME accredited fellowship. And that's been certainly a big change for a lot of the ENT field.
Say that again, Tom. Say it slow one more time.
So if you wanted to become an ENT boarded in sleep medicine after 2011,
Yes.
you had to essentially do a sleep medicine fellowship,
Yes.
the accredited fellowship.
ACGME accredited, so I can't do one of those pure surgical ones that are non-ACGME.
Correct. And there are certainly still a tremendous value in those as well. And you certainly don't want to discredit them because, some of those have really been incredibly influential on our field and put out some wonderful trainees and attendings and surgeons out there as well. For myself, I did a hybrid, meaning that it was a sleep medicine, internal medicine driven fellowship, but also carved out time for sleep surgeons. And as ENTs have really started to get more and more involved in this, there's been a lot more fellowships that have started to pop up with this type of model on there. And so
it's ACGME, those are ACGME.
Correct. Exactly right. So I think at last count, there's about 10 across the country as well. And so for a lot of trainees out there, it can be really hard to actually find this information. And so, places where trainees go, so Head Mirror, a really popular ENT website. The other plug I'll put is for the International Surgical Sleep Society as well. And so we've been building big fellowship database. It's free for members. And it just so happens that any trainee can be free or have membership for free as well. And so you just have to really sign up for it. And then we have all kinds of information on all these fellowships for all these trainees out there. And even if you're not a trainee as well, it's certainly really valuable to actually take a look and see what all is out there.
Ryan, before we go to you, I just want to go back, Tom, because this is very important. So what is the URL for International Surgical Sleep Society?
It's surgicalsleep.org.
Surgicalsleep.org is the URL domain for the International Surgical Sleep Society. And I can go there and get a list of the ACGME 10 fellowships that are surgically and internal medicine hybrid. Is that right?
Exactly right. And so we have also the sleep surgery specific non-ACGME accredited fellowships there if people are interested in that as well. But we're trying to be really comprehensive on it. We try to be really thorough and try to give people an idea of what actually these fellowships are going to mean for their life for that year or potentially 2 years they're there.
Do you, and Ryan, I promise I'm going to go to you, but I don't think we need you. We've got your mentee here. Tom, how many members does the International Surgical Sleep Society have?
No, at last count, this is as of beginning of this year, there was about 300, over
Thanks.
300 of them. And there is about 120 trainee members on that.
Wonderful. So Ryan, who am I competing with? I did my training at Tufts Medical Center in Boston. I'm a PGY5. Y'all have hooked me. It's not too late because I think one of you will tell me when the cycle starts. When does the cycle start as a PGY5? Beginning of PGY5 year?
Correct.
Yes.
Okay. All right. So right now we're in March. By this time this airs, it'll be April. It'll be perfect timing. So Ryan, who am I competing with? Do people do general surgery and then go into it? Or is it really these 10 are only really for otolaryngologists?
These fellowships are for anyone interested in sleep medicine. And so the Sleep Medicine Board, again, that was reorganized back in 2007, is a joint board with internal medicine, pulmonary, pediatrics, ENT, neurology, and psychiatry.
Oh, we're the only surgeons in there, Ryan.
We're the only surgeons in there, exactly. So again, these are ACGME accredited sleep medicine fellowships, which there are many of, dozens of all around the country. These are roughly the dozen that also have sleep surgery hybrid built into it. So an ENT could do a sleep medicine fellowship at any of those places. But one of the previous concerns for many ENTs was I don't want to go a whole year without operating.
Yeah.
And so the 10 or 12 that Tom is really referring to are the ones that have big academic sleep surgery leaders built into the sleep medicine curriculum.
Okay.
So right now, for example, at the University of Pittsburgh, we have 2 ACGME accredited sleep medicine fellowship positions. And it could be a pulmonologist, psychiatrist, neurologist, or an ENT. This year we have an ENT fellow. And regardless of if we have an ENT or a medical specialist, they rotate on the sleep surgery service. Now, if it's an otolaryngologist, they're really involved and they're doing a deep dive into really honing advanced pharyngoplasty techniques, really learning all about nerve stimulation from pre-op patient selection, DICE, the implant, the post-implant care pathway and therapy management, hypopharyngeal surgery, lingual tonsillectomy, advanced nasal surgery. They even get to spend some time with our sleep dentists on learning about oral appliances, as well as our maxillofacial surgeons on some skeletal work. So for an otolaryngologist, they get the whole sleep medicine education so they can sit for the boards, but they also get a really deep dive into the sleep surgery aspect.
And so if I was a neurologist or internal medicine, I might shadow the OR. I'll be with you rounding, I'll see them in clinic, but in the OR, it's obviously a little bit hands-off.
You got it.
Yeah. So my wife and I share studies. So she's right next to me. She's internal medicine through the Mass General system. So we could have done fellowship together.
Exactly. It's never too late.
Yeah. You guys have fired me up.
If you struggle and struggle and struggle with CPAP, you should check out Inspire. No mask, no hose, just sleep. Inspire, sleep apnea innovation.
So, Tom, I do want to spend time because I'm getting pretty excited here as a value add for our members. So out of those, there are 12 that are surgical. 12.
There's roughly 10 or 12, but that's.
And that website has them all, right?
Correct.
Yes.
All right. How many spots are there overall? You have 2 spots, 1 year at a time. How many spots are there in the country? About 20?
Well, in the entire sleep medicine curriculum, I think there's over 100.
Wow. How about the hybrid surgical and then sleep?
Yeah, the hybrid spots, then I think you're looking at probably up to about 20 potential match spots, and each has its pros and cons. And there are, different ones that focus on different areas. I mean, for example, one of our former residents actually did a 2-year sleep fellowship at Stanford, where they did a whole year ACGME accredited sleep medicine fellowship, and then a whole year non-accredited sleep surgery fellowship.
Wow.
So that's part of the reason why these numbers, where Tom and I are not trying to be vague, but just depending on how you define some of these. But yeah, there's roughly about 10 programs that have really invested a deep dive into the hybrid format of the curriculum, which probably equates to at least 15 to 20 spots for interested residents.
What's fascinating, and Ryan, you might be able to answer this since you are a little bit senior to Tom, that the supply and demand seem to be just aligned right now. You're not pumping out 5,000. 20 seems like the right number. The innovation is really taking off in the field. So it seems like a really good time. Am I right with that? It seems perfectly balanced.
Yeah, this has been what's excited me the most about it. I mean, being in a field like this where, number one, the numbers are off the chart. So roughly, just to give you some ratio here, for every person in the US that has head and neck cancer, there's about 1,000 people that have sleep apnea. And that's just adults. That's not even counting the elderly. That's not counting pediatric OSA. That's not even counting non-apneic snoring. So we're talking about 1 billion people worldwide or more. So the numbers are staggering. The business is there. And because it's in its infancy, there is so much research going into new ways to treat this. When I trained, it was CPAP or UP3.
Yes.
Right? And they were often siloed in their separate practices. And now what we do, having this hybrid setup and what we've tried to employ at the University of Pittsburgh, and Tom has now modeled beautifully, is where the otolaryngologist is at the center of sleep apnea care. Just like the otolaryngologist is at the center of head and neck cancer, for example. And so as sleep boarded ENTs, we can now run all the diagnostics. Tom and I read our own sleep studies, home portable and in the lab. We treat the nose. We do the pharyngeal surgery. We do nerve stim. We work directly with the dentists on orthodontics and oral appliances. And then guess what? We also treat with CPAP, and we troubleshoot the CPAP, and we work with sleep-related medications. We treat all their other sleep disorders, the restless legs, the insomnia, sleep health. So it really provides that holistic approach.
Wow.
And then on top of that, you have all the research and innovation that's going on with new nerve stim methods and other new ways to treat this condition that I'm sure Tom can, speak to.
So I finished residency in 2005, fellowship in 2006. I had my 50th birthday a couple weekends ago. I think I want to go back, Ryan, and do sleep. I mean, the way you're describing it, Thomas, for someone who has a career of 30, 40 years ahead of him, there's a lot. You can do surgery. You can do medicine. There's some psychology to it. There's medication. There's a lot that you're never going to get bored. What does a day look like, Tom? Let's get our residents. So our residents are hooked. They want to do a fellowship. Let's just pull back. You can also do private practice. Okay. So from here, from what I'm understanding, if I was a resident, I probably would get big eyes and say, wait a minute, I'm going to create a sleep center. And I hope nobody's done this, guys, because I'm going to go do my fellowship. Give me a year. I'm going to create a sleep center. I'm going to have an ASC. I'm going to do surgeries only for sleep. I'm going to employ neurologists. I can create a huge business. Is that going on in the sleep world at scale?
Sounds like the Shaw Sleep Spa.
Yeah. Or just Shaw Sleep. Hey, can I hire you guys? I won't do the work. But this is not just for academics, gentlemen. It's for everybody. Is that right? I don't know, Ryan, if you want to do that, or Tom, whoever wants to take that.
Yeah, go ahead, Tom.
Yeah, well, I was going to say, Ryan spoke to the numbers of patients in need
huge.
Of a good sleep physician. And I would say ENTs being the quarterback of that situation makes so much sense.
Yeah, I agree.
For residents who want to go into private practice, listen, if you want to get busy quickly, look at the CPAP compliance rates for the past 20 years. It still hovers around 50%. And if you take those numbers that Ryan mentioned and you divide that by 50%, that means there's so many there's so many patients out there in need of help, in need of alternatives out there. And it is very easy to build a practice around this, whether that's private or in academics, around a sleep fellowship. It truly, I think, can be a wonderful way to practice ENT.
Do we know, Ryan? I mean, I'm getting so excited. I'm going to break away and Google it. Are there multi-physician groups that have PAs in sleep? I could see a huge building actually that does that. Are they? There must be a couple of those out there.
Yeah, I think these multidisciplinary sleep teams and practices are becoming much, much more common. And you can envision a scenario where you could have a pulmonologist, a neurologist, an otolaryngologist, and a dentist, and you'd really be able to masterfully treat this very heterogeneous condition very well.
Yeah, I think my wife isn't here, but you three could be a great team. I could be your leader.
Yeah, and I just want to emphasize to the otolaryngologists out there for so many years, and this isn't to disparage any other specialties. Sleep apnea has been managed primarily by pulmonologists and neurologists, and they've done a fantastic job. But the reality is it's an upper airway condition that is affected a lot by upper airway anatomy, craniofacial, nasal, pharyngeal anatomy, and upper airway physiology. And in my opinion, there's nobody better positioned to evaluate and examine and phenotype and to treat an upper airway condition than an otolaryngologist.
I would say, honestly, you and I trained really, Ryan, around the same time. And so UPPP and CPAP. I remember, I would do 5 or 6 UPPs, but part of my frustration was I thought, is this it? So kudos for you to see past my narrow-mindedness to know there's a huge field out there. So Tom, what is a PGY5? What are they getting excited about if they're going to do sleep? What does the future look like? Ryan felt it in 2007 and 2008. This is your chance. What are you seeing out there, Tom, that the future looks like for sleep in the next 15, 20 years?
Well, Ryan said this to me the other month, he said this is basically the golden age of sleep. I feel right? There's never been so many more options for patients and providers.
Interesting.
And there's never been, I think, so much investment and interest also in this field as well. And so,
True.
from the industry side of it, industry is heavily involved in it. So there's Inspire, obviously, but there's other nerve stimulation companies coming down the line. We think about hypoglossal nerve stimulation, but there's other nerve targets people that are working on as well that it can be easily, or we think easily, combined with these hypoglossal nerve stimulators. There's these new pharyngoplasty techniques coming along. There's also these new skeletal surgery techniques that people have been working on implementing. That's not just the double jaw advancement anymore for patients. And so you combine that also with the public interest as well. And so I would argue right now, I don't think patients have ever had as much information or knowledge base when it comes to sleep apnea. And so there's so many more patients coming in with their wearables. There's so many more patients coming in with already a strong knowledge base about it too, that this is a continuing, it's going to be more and more growth on it over here in the next, I would say 10, 20 years even.
Yeah, I would say, Ryan, to that.
Can I just say something real quick? I'll give it back to you, Ryan. No, let me give a message to our trainees and those that are listening. Follow the money, folks. So if industry's coming after this, if they're making big investments, they realize there's a huge captive market. Ryan.
Yeah, just to build on that, there's some other targets too. I mean, one of the things that really wasn't a topic when you and I trained, but is now, has to do with tongue and parapharyngeal fat. So one of the most recent advances in the field is the GLP-1 medications now just secured FDA approval for an indication for sleep. And that's specifically because when people lose weight, they lose weight in their tongue, they lose weight in the parapharyngeal fat pads and other aspects of the neck that improve the disease. So now there's a lot of innovation, for instance, like cryotherapy and other things of how we could selectively reduce fat in the tongue and upper airway. There's other medications that have recently been approved for sleep apnea that affect the brain's control of the muscle activity and the brain's control of central ventilatory control. There's interest in pharyngeal exercises, like SLP exercises, tongue, palate exercises that improve the muscle tone of the pharynx. And that's just the tip of the iceberg. So to Tom's point, yeah, this whole field is really set to explode with a huge toolbox of treatment options that the otolaryngologists are really poised to lead.
So Ron, you can actually write a script for a GLP-1?
That's correct. As of December 2024. Yeah.
Wow. That's like power. Tom, and then I want to go back because I didn't know the tongue had fat. I knew the parapharyngeal space had fat, but I actually didn't know, Ryan, that that's how it worked. I thought it worked because of your neck circumference. And guys, I've got a 16 and a half neck, but hopefully by keeping it open, it reduces my risk of sleep apnea. But I didn't know, Ryan, that was a mechanism. That's pretty cool that it actually reduces the fat there. And they show that histologically?
Yeah, it's been shown on MRIs now that, again, when people lose weight, they lose it in their tongue and lose it in their neck. So now, we have another target, particularly because GLP-1s too are expensive and they have side effects. And there are other ways, borrowing from plastic surgery and other fields, to reduce fat through apoptosis and other things.
Yeah. Sorry, Tom, I know you want to get in, and I told you we'd keep this to 25 minutes, but I don't care. This is so exciting. So I was speaking to an allergist today, and they said, when you see an allergist, sometimes they have rhinologic issues and they might need septal surgery or sinus surgery. But it seems like the captive market, someone might come to you because of a sleep study, because of their Oura ring. You might start on a GLP-1. It might work. Maybe septal deviation, maybe nerve is better. It's almost like you can continue to grow, and the lifetime economic value of a patient is actually not just the GLP-1. It could be a lot of ways you can help the patient.
Oh, and that was actually what I was trying to get to as well, because I get so many questions these days. Well, is GLP-1s hurting you on the bottom line? The bottom line is actually we have so many more patients now coming to us who are on GLP-1s. Actually, the reality is this is going to be another, I would argue, a very valuable tool in the tool chest. But it is certainly by no ends or by no stretch of the imagination going to be the end of the story. But I think it's going to be extremely valuable for us to be able to help our patients, especially say, they have Inspire and they don't respond well. I mean, it's maybe a great opportunity to add on a GLP-1, vice versa. I mean, there's all kinds of possibilities that this adds to us in terms of what we can provide to patients.
Wow, the heterogeneity of your day is awesome. Ryan, I'm going back to 2005 and 6, where my professors would do a couple UPPs, put someone on CPAP, and walk out of the office with their hands in their coat because they didn't have options. It's amazing what the horizon is out there, folks. So you've convinced me to go back with my wife at 50 years old and do a fellowship. What parting, exciting words would you give to our PGY4s that are going to be listening to this and PGY5s about the future of sleep? And maybe we'll start Ryan, Thomas, and then have you all conclude.
Yeah, well, I would say the biggest reward for me is the day-to-day patient satisfaction.
Yeah.
It is incredible when you can improve somebody's sleep. Their mood improves, their headaches are less, they work better, they feel better, their relationships are better. We even have spouses come in tears because now their sleep is better. So it's incredibly rewarding when you get better outcomes. And what I would focus on is that unlike when you and I trained and it was just about treating the AHI, treating a piece of paper, now we're really treating the patient. And what I mean by that is the majority of these patients don't come in to have their AHI treated. They come in to feel better. And the reason they don't feel good is often because they have 3, 4, 5 sleep disorders. So think of the average person that has OSA, but they also have fibromyalgia and COPD, and they're on 10 medications that affect their sleep. And oh, by the way, they work shift work and have a special needs kid at home. And all of those things affect their sleep. So when you have this background in sleep training, I feel like you're really poised to then apply a multimodality treatment plan where you improve their sleep health and habits, their circadian rhythm issues, their insomnia issues. You adjust their meds, you treat their sleep apnea. And when you do that all in one, you just it's transforming for people's lives. And that's what's been most rewarding for me.
Yeah, very well said. Go ahead, Tom. Try to up that one. How do we get the PGY4s excited and the future of our specialty?
You can speak about job satisfaction, but let's talk about jobs as well. And this is something that we looked at as well. We did a survey of recent graduates of sleep fellowships on it too. 90% of them got academic jobs. 50% of them went back to their institution that they trained their residency at. There is, I don't think, a better field within ENT right now when it comes to actually job market than sleep medicine, sleep surgery for it. I mean, it seems like all the academic departments these days are wanting someone to actually take up this type of practice within their own institution. And then from a private practice standpoint, I mean, I don't know of a way to get busy quicker than to have sleep as a central portion of your practice on it. And when you compare that to, the 2023, workplace survey that the Academy put out to, 50% of the PGY5s wanted to go into academics, and what do they care about? When they care about work-life balance and they care about career goals on it.
Yeah.
Argue there's not a better field for either of those things. The work-life balance I find is fantastic. And then the career goals is exceptional. It's such a young field right now. I imagine this is probably what rhinology was 20 or 30 years ago when people were taking the endoscope in the nose on it. I mean, there's not an easier field, I think, to make a mark on than the sleep surgery. There's so much opportunity. It's like a box out there right now in terms of what you're able to do, the questions you're able to ask and answer on it. I mean, it's phenomenal. And so I highly, highly encourage anyone interested in by what Ryan and I have talked about here today to look around, look at the International Surgical Sleep website.
So one more time, give them the URL of that.
surgicalsleep.org.
And then can you all just rattle off your email, Tom, quick, and then Ryan?
Absolutely. So my email is my last name. It's a really long one. I apologize, but it's Kaffenberger, KAFFENBERGERTM @upmc.edu.
Super. Ryan, you want to say anything before you give us your email?
Yeah, I just also want to say that I think in addition to the job opportunities, the residents should know too that more and more hospitals and institutions now, in order to get reading privileges for sleep studies, they have to have board certification, which also requires the fellowship. We now have some ENTs that are becoming medical directors of a sleep lab. And so there are other career path benefits downstream to having this training. But I would also say on an informal level, one of the things I've noticed in myself and then I see in the residents now, it really having that fellowship training and board certification gives you what I would call the street cred.
Yeah.
where you have the same training then as
Yeah.
all these other members of the American Academy of Sleep
That's
Medicine,
right.
for example.
That's right.
And it really opens so many doors from a research and academic standpoint.
Yeah.
My
Very
email
well
address,
said. Yeah. Email address. That was awesome.
SOOSRJ, SOOSERJ at upmc.edu.
Great. And folks, if you didn't get it, just play it backwards till you get it. Tom and Ryan, I can't thank you enough. This was awesome. Awesome. I'm super excited about the specialty, about the innovation, and your all enthusiasm is contagious. So I want to thank you both very, very much and look forward to learning more myself about sleep fellowships and for our specialty. Thank you.
Thank you, Dr. Shaw. I really appreciate your time and interest in this, and maybe we'll see you on the interview trail. Again, it's
Right on.